So, welcome to part two of toileting issues in dementia care. I'm dementia coach Diane, and I'm sharing my journey as I care for my husband Ben, who's living at home with Lewy body dementia. Now, I do need to help my husband at this point with all aspects of his elimination events. He doesn't actually use um, the bathroom that much anymore. And so my issues are a little different, and I'll certainly do some more videos around that. But if your loved one is still using the bathroom, you want to remember that there are still a number of steps involved when someone is eliminating and needs to get cleaned up afterwards. And what we want to do at all costs is to preserve their dignity and to help them feel calm and peaceful, even as we might be either reminding them or reintroducing them to the steps that are involved in getting cleaned up. So this is in response to a follower who said that her husband, she wasn't sure if he was using both toilet paper and wipes, and he was complaining about the size of the wipes. So in part one, I talked about some of the different products that could be used. But in terms of how to frame it, it's so important, again, to maintain their dignity and encourage a smoother routine. So first of all, for instance, you want to blame the products and not him. People with dementia are most often more receptive when the focus is on fixing a thing rather than fixing them. So, for example, you might want to say, hey, I noticed that those wipes are pretty small. No wonder they're not working so well. I found some bigger ones that should be way easier for you. This way you're offering a solution rather than making them wrong. You're not really pointing at the problem directly. You might need to offer step-by-step guidance in a respectful way. If you find yourself helping your loved one in the bathroom or offering reminders, you could actually gently walk them through the process. Something like, okay, let's start with some toilet paper first. That'll get most of it, and then we'll finish up with a wipe so you feel nice and clean. Pairing steps with a positive result, feeling fresh and clean or feeling comfortable, that may also help them to be more willing, to follow along. Also, again, make it about comfort or hygiene. If they're resisting using toilet paper for some reason, you might say, hey, using toilet paper first keeps everything cleaner, and then the wipes can really do their job right. Again, framing it as a helpful trick rather than like a correction can go over better. You might also want to create visual cues. For some caregivers, adding simple visual reminders can really help. Like, for example, you might want to place a roll of toilet paper like on top of the wipes container, so they use the toilet paper first and then they use the wipes. Or really, sometimes even a little note that's right in front of them, right in front of the toilet. Oftentimes, you can put something right across from that and just, step one, toilet paper. Step two, wipe. Step three, toss in the trash, or flush the toilet. So these can seem like such simple things, and I know that it's hard to really know what's going on in their minds. We don't know. So we need to experiment and try to draw them out as much as we can to find out what's causing them to resist, following the steps that they used to do without even thinking. But now it gets confusing, and things that, we do without thinking, they need to process in a different way. So anything we can do to help them is actually going to help us in the long run as a caregiver too. So I hope some of these tips were helpful. Once again, remember there are both products that can help us with our loved ones when it comes to the whole issue of elimination events, and there are ways that we can gently guide them through it as well. So thank you so much for giving a thumbs up if this has been helpful, putting your own tips in the comments, and subscribing if you want to see more video more videos like this, that lets me know that I'm on the right track. All right, thanks so much. Remember, together we're stronger. Together we got this.